Hi, I am Dr. Amitabh Sood, MD DM Endocrinology. I am working as a consultant endocrinologist at Peerless Hospital, Kolkata. Today, I am in front of you to discuss a very relevant topic, which is association or relationship of COVID-19 and hypertension. Dear friends, this is a topic about which you must have been acquainted with because a lot of news are coming in the media also that whether hypertension is at all related to COVID-19 or not. So many myths are unfortunately getting circulated, and it is important for us to clear out these myths and to bring fact in front of you. Just a brief introduction of the topic. Hypertension is something which is very relevant in our day-to-day life. Many of us, roughly 25% of Indian adult population, are suffering for hypertension. It is very important for all of us, whether it is the COVID period or non-COVID period, with or without drug, to keep our blood pressure in normal range, which is less than 130 and 80 millimeter of mercury. This is important because you must be aware of that hypertension is actually one of the leading cause of cardiovascular mortality, morbidity as well as stroke in our country and also globally. In fact, if a study is done or if a prevalence study is done, then it is a matter of fact that for patients who are suffering with CKD stage 5 and who are undergoing dialysis, roughly 80% or 90% of them are having either diabetes or hypertension. So this is such an important problem. Now, right from the beginning of this COVID period, some myths have been circulating about hypertension and its association with COVID. The most common myth which is going around is whether hypertension or having high BP increases the risk of COVID-19 infection. The fact is, it is not true. Increased risk of infection is not seen in patients who are having either high BP or hypertension. It is only the severity which increases with hypertension. That means the patients who are hypertensive are having greater risk of getting severe COVID-19 infection. Second myth is drugs which are used to treat high BP are associated with increased risk of getting COVID-19 infection. Again, this is a myth. The fact is none of the antihypertensive drugs, including ACE inhibitor or angiotensin receptor blockers, are associated with increased risk of COVID-19 infection. This is completely untrue. You can continue to use them safely. Third myth which goes around is it is not important to consult your doctor regularly during this COVID-19 pandemic. No, sir, it is not true. It is very important to get in touch with your doctor regularly because hypertension management is important. As I already said, if your BP is not under control, if you do not change your drug appropriately with time and you remain uncontrolled, then it is difficult and you can get severe COVID-19 problems. Fourth myth which goes around is about diabetes and hypertension. It says that whether controlling your diabetes is related to controlling hypertension or not. Yes, they are both intricately related. It is not true that they are unrelated. You must control your diabetes also apart from hypertension. Your HbA1c should be 7% or less, which is a 3-month average blood glucose, and your pre-meal blood glucose with drugs should be less than 140 mg per dl. And the fifth most important myth is I cannot do exercise because I cannot go out. This is a common complaint of patients. This is again not true. You can do regular aerobic exercises and resistance training exercises inside your premises, inside your home also. And if you can maintain proper social distancing, then you can also go out to do your exercise that is not contraindicated or that is not forbidden. So next topic of discussion is how can you manage your blood pressure at home? Before that, just a brief information to you about high risk factors for blood pressure or hypertension in our country. Most important risk factor is genetic. Apart from that, poor dietary intake, particularly unhealthy dietary intake, consumption of trans fat, increased consumption of salt, and co-association with diabetes because diabetes is rampant in our country. These are the factors which contributes to high incidence of hypertension in our country. Particularly in COVID time, the high incidence of hypertension is being seen, and this is mainly because of stress. So you need to mitigate your stress by practicing yoga, meditation, and getting informed about this COVID-19, removing myths from your mind and bringing in facts in your mind. That will help you in reducing your stress level. Apart from that, you can also practice other measures to reduce stress, as I have already said, meditation and all. Second is you need to do proper exercises even during this lockdown. The exercises like aerobic exercise and resistance training exercise can well be done within premises of your home. And if you can maintain proper social distancing, then you can also go out and do these exercises. Lack of exercise is also contributing to high blood pressure seen in this lockdown period. And most important is eating habit. You need to maintain balanced eating habit with more stress on vegetables, fruits, and nuts, and less stress on oily foods, because inappropriate eating habit has been witnessed in this lockdown period, and because of which a lot of people are gaining a lot of weight, and because of that they are becoming obese, diabetic, as well as hypertensive. Apart from this, you must take your routine blood pressure medication properly and in time, and also you should somehow you should check your blood pressure either on your own or by someone regularly to see whether your blood pressure is in control or not. And if your blood pressure is not under control, then you must visit your doctor for appropriate adjustment of your antihypertensive medication, because it is important to keep your blood pressure less than 130 by 80 systolic and diastolic to reduce the risk of getting severe COVID-19 infection, if at all you get COVID-19 infection. So this is very important. And if sometimes some fear complexes are there in our mind, though it is not true, but then we are afraid of visiting hospitals and clinics. For them, you must talk with your doctor for alternate mode of consultation, because nowadays many centers have alternate mode of consultations, like video consultations are available. And antihypertensive drugs, if you can inform correct BP to your doctor, correct pulse rate to your doctor, then the antihypertensive medications can also be altered over telephonic conversation. With this, I conclude my today's topic of discussion. Thank you all for patient listening, and also I wish you all a healthy life ahead, a stressless life ahead. Thank you for listening out to me.